And action.
I don't know.
Oh, you don't know what you're doing?
No, we're doing deltoid IMs. Okay.
Right.
So, what am I starting with finding the side?
So tell me, yeah, just before we begin, I want to make sure you know.
Okay. Well, there's a few different ways. You can do the 2 fingers breath down.
From what?
From the point.
Acromion?
What point is this?
Acromion.
Acromion process. So 2 fingers
2
breath
fingers
down.
breath down, and then the deltoid is right there. Or you can go from the axillae across the arm. You're also at the deltoid. Or if you have the person.
Okay, so what you do with that line, what do? You do a triangle between the acromion process to that line, and it's right in there that you're going to get. Okay, so your landmarks are the axilla, the line that goes across the axilla, and your acromion process, the triangle, and you get it in the middle.
And the other way to find it is if you have the person lift their arm, the deltoid flexes up, so you can see it. I know she's got guns.
Look at those deltoids.
Look at that.
It's lifting all those fat patients.
Those fat Oriental patients. Yeah.
I have a quick question. I recently had an IM, and the nurse told me to twist my arm.
Oh, that also
is that okay?
that
out of
flexes it out.
curiosity,
Makes you
is
see
that
it.
okay?
Yeah.
To do?
Yeah.
Okay.
But you flex it, so you're making sure you're giving it in there,
Yes.
right?
Yeah.
Okay, good. And none of y'all should have any problem with the deltoids with the babies. I mean, the babies, if they just move their legs, you can just see. They don't have enough subcutaneous fat. You can just see if you give it anyplace else. It's because you're not using your eyes. Okay.
So what's my order?
Okay, so your order is same thing. Depo-Provera 150 milligram IM once before discharge.
All right, so that's my order, and this is, what are we saying this is?
150 milligrams
Per
per
mil.
ml.
Okay, so that's the order. I'm going to be giving 1 ml of this. Nice.
So now, have you looked at your order to make sure it has a 5 right?
Oh, we're looking in here. This is the order. All right, so that means
Doctor's handwriting. Yeah.
right med, right route, right time, right patient. Dose. Thank you. All right, so that would be 1 ml, which is 150 milligrams, once per day. So this would be it.
No, it's not per day. It's once before discharge.
Once before discharge.
You only
So
get it, how often do you get Depo?
Once every
3 months.
yeah. So they'd be getting it right before discharge, which would be now. It's the right patient, so verify that. Are you the patient?
Yes.
Okay. So, and then
It's been a few years
right
since I had
route.
to take Depo.
Me too.
This would be, it's crazy.
It's a weird day for both of us.
You get good press.
Am I not using this? Am I starting over?
Do we have a new one
Three.
of those?
This is.
Somebody
this
look
is a
over
3.
here.
This is a 3 mil. I can
There's-
use that.
Okay, but you don't have a safety net.
David, get out the 3 mil with the syringe.
There's a safety.
22 gauge.
No, do we
But
have
we
a?
already used it, didn't we?
Yeah, these are
David's gonna
empty.
get one. David's gonna get one.
So obviously we would have put all this stuff away in
Yeah.
the sharps.
This
right?
went in the sharps, David. Where'd you go?
Hardy.
He's out of here. He's celebrating.
Here,
Thank
sharps,
you.
David? Do you have a sharps
All
container?
right.
Yeah, it's over there.
It's over, I think there's one, I took one off there. Back yonder.
All right. So open.
Thanks.
Alcohol. Put that once around.
Do you want to just
Why is it
talk
wrong to
through
say
it?
Oriental?
Because it refers
That's
to
a thing,
objects.
like a rug.
Right, right. It's the imperialist view.
Don't worry,
right
my
there.
mom used to call me Oriental too.
It's the colonizers' way of saying they're, the other, the Orientals as opposed to.
So you put the blunt. So just talk through.
Oh, sorry. I'm sorry. So I put the
They were
blunt
Orientals
needle
of,
on, and I'm going
United
to
States
withdraw
and
1 mil of air to add to this.
And does
I
the
would
tip
then-
of it's in the solution?
Yeah, I purposely put it so the needle is not into the empty space of the,
Very good.
Med.
You hear that, everybody?
and then I would inject the 1 mil of air, and then withdraw 1 mil of med. Oh, and I have an air bubble. That's okay. I'll withdraw a little more than 1 mil, and shake it out.
Also, just sometimes when you're doing that, if you're holding this like this, you are very steady. You know, you can see everything, and this is right there, so it's not like this is your. You have sort of a
Oh, I was
pivot.
trying to show the camera.
Yeah. Oh, you're trying
Yeah, so I had it turned
Oh,
so she
okay,
could.
okay,
Did
okay,
you just
good.
push the air?
He hasn't
Yeah,
cleared yet.
not totally. There's still a little in the pipe, so I'm gonna push the air up. Some's gonna
And
come
we usually
out.
call that pipe the needle.
Yeah. That's right. I mean, if you work in
I'm just
healthcare,
joking.
whatever. And then
You could use a pipe if you use a needle.
add that on, and then I do my second check. So it's 1 mil, which is 150 milligrams, which she's getting in the deltoid at discharge.
checked it, right?
Yeah,
Okay, right patient.
right patient. So this wouldn't be going in a man.
And what needle are you using?
Because it's IM, you want to use 22 gauge and at least a 1.5
So don't
inch.
don't open this because we're going to open that. Oh, it does have a needle. Good.
Yeah. Yeah, you could use a 1 inch for younger.
Now, if you have a
Is that
if
one
you
inch?
have
Yeah.
a syringe, it's not together like this. If you just open it like this and hold it like this, and then you can put it in like that without.
I see what you're saying. So, like, if I just took that off
Yeah.
and then picked it up.
Right.
All right. So then I would go into the patient's room and I would bring
What are you missing here?
this guy. Oh, yeah. I bring a pad, this, another alcohol swab, which I don't have, so I'm going to reuse this one. But we all know this is a brand new one.
So now he doesn't have to tell me the 3 ways of identifying, but he's just going to do one, right? Okay. Spot.
So I go into the patient room, and then introduce yourself like we've been trained, check, verify name, date of birth with patient, and that's when I would do my third check right there. So, okay, I am giving the, what am I? Thank you, Depo-Provera. I don't even know it. I am in the deltoid right before discharge, which is happening now, and this is what I have. And I'm giving 1 mil, which is equivalent to 150
So if it says
milligrams.
right, if it says before discharge, you can give it any time that they're in the hospital, as long as it's before they went home, right?
Yeah, and document it so that no one else gives another one. So to find it, let the patient know what I'm doing, and so we're going to put it in your deltoid. So I like this one, just lift it because then it's right there. Or, we all went over the different
Wait a minute.
routes.
Have her lift it.
Yeah,
No, don't you lift it. Have the person lift it. Because they have
Yes.
to use the muscle. Right?
To
So you look at
engage
the
it.
muscle.
Yep, so it's right there, and then...
So show me where you're going to get it.
Okay, so if I was going to give it, they would be sitting up. It's hard to do with you right there.
I'll move.
Because if they were sitting here, I would have them sit up. Then I would kind of stand behind them with the needle
But
in
show
one
me,
arm.
show me where you're going to insert
And
it. I
then
want to see it.
I would go down
But
like
where?
this.
Show me where. What is
Oh.
the spot that you're pinpointing?
Right. So can I have you lift your arm? Yep. And do it. And then you can relax your arm. And then I would go in right here.
Right. So you want to give it. Try not to go on the lateral aspects. You want
Yeah.
right in the middle of the deltoid, right?
I don't know if you guys could see that because I'm kind of hiding it, but...
He's doing a very weird arm motion, but
Yeah.
he knows where he's going, so that's okay.
All right.
That's Professor Suzanne's
Really?
All right.
Oh, okay. Well,
feet.
I said it's okay.
So...
That's on video.
So, clean it, or clean it here,
Okay, good.
and then I would hold this,
Very good.
and you want to hold it so that you can still spread.
Right.
Draw needle. So you-
And sometimes it's nice just to tell the patients take a deep breath, because by the time they're thinking about taking a deep breath, by the time it's over, they don't feel anything.
So you spread, you go to 90-degree angle because we're doing IM.
Now I'll tell you. Okay, go ahead, finish. Then bring this
hold
one.
it.
Breath. Oh, what am I doing?
Just holding. Remember,
Oh.
you can hold it with the. You can steady your needle with your.
Oh,
hand,
yeah,
remember?
that's right. You just said that.
Yeah.
So spread, as I went in, I hold it, then I push, then I withdraw, and this goes right down. And if I had, and as I'm holding that down, flip that
Very
up.
good.
And if I had a Band-Aid,
So now,
document.
one thing, how were you going in? Were you going in like this?
How was I going in? Yeah, I was going in like this.
That's dangerous. Why?
Because you could press the plunger before you
Right. So
Oh,
you
yeah.
never hold the plunger.
So
You
you-
don't. You're doing it
Go
Your
in
wrist-
and then
and then put it up, right? Because otherwise you could actually inject it as you're going in.
losing meds. All right.
Okay.